Before participating in any of the following flexibility protocols, perform a full body 5 to 10 minute warm up. To perform the chair sit and reach test, grab a stable chair that is 17 inches high and place it against the wall and instruct the client to sit in front of the edge of the seat. Have the client extend the leg being tested with the heel on the floor with the ankle forming a 90-degree angle. Have the subject place their hands directly on top of each other so that the length is equal. Instruct the subject to hold the stretch for at least 2 seconds and measure the distance from the sole of the foot to the end of the middle finger. Using a ruler, measure the reach distance in inches with a reach to the toes equaling 0 inches. This protocol is most appropriate for the elder population, usually those that are 60 years of age and older, and it serves for the purpose of measuring hamstring flexibility. For best results, it is recommended that the subject exhales while performing the reaching movements. The protocol should be performed on both legs to determine if any imbalances exist. The Canadian forward flexion protocol entails having the subject sit on a flat surface with their back up against the wall and having their heels placed up against the edge of the sit and reach box. Both hands are parallel at the same length and come in contact with the measuring portion of the sit and reach box. The subject exhales during the stretching movement and is allowed to perform the protocol twice. Ensure the subject keeps their legs straight at all times and holds the stretch for at least 2 seconds. The higher value out of the 2 attempts is kept and is recorded in centimeters. Due to the starting position of the box, 3 centimeters will be subtracted from the values shown on this table. The female subject is 20 years old and recorded a reaching distance of 43 centimeters. Subtracting the 3 centimeters from the value given on the table, anything over 38 centimeters for women between the ages of 20 and 29 is considered excellent. Having said that, the value of 43 centimeters places the subject at the excellent category. For the YMCA protocol, a yardstick, some tape, and a rigid wall will be required. Instruct the subject to remove their shoes and have the subject sit so that the yardstick is between their legs. A 10 to 12 inch piece of tape should be adhered to the 15-inch mark in the yardstick. The legs are positioned so that the heels touch the edge of the tape and the hands are positioned directly on top of each other. Have the subject exhale during the stretching phase and have them hold the stretch for at least 2 seconds so that the recording can be made. Allow the subject to perform the stretch twice and record the greater value of the two. Like the previous protocols, ensure the subject is exhaling during the stretching phase. Much like the Canadian forward flexion test, this protocol assesses lower back flexibility. The 20-year-old subject covered a distance of 21 inches, which places her in the above average category in the 70th percentile. The Thomas test will assess the flexibility of the hip flexors. A participant will lie on their back, bring the leg that is not being tested towards their chest to the point where the lower back is snug up against the surface. Tested leg is observed to determine if surface contact was maintained. The position is held until the measurement has been made and a trial is performed on each leg. In this case, the subject maintains surface contact with both legs, which denote her as flexible. The purpose of the straight leg raise test is to determine the flexibility of the hip extensors. To perform the protocol, have the subject lie completely straight on a flat surface. Ensure the lower back is pressed up against the surface. Manually raise one of the participant's legs and ensure the other leg is completely straight up against the surface. Raise the leg as far back as possible and have an assistant hold the leg in place while the measurement of the angle is made with a goniometer. For this test, 90 degrees or higher is desirable, 80 to 89 degrees is acceptable, and anything less than 80 degrees is unacceptable. The client exhibits an angle of flexion of 90 degrees, which puts her in the excellent category.